Hello, nursing students. Today we are covering Anatomy and Physiology, Chapter 20, the Digestive System, and this book is the second edition by Pearson of Understanding Anatomy and Physiology. Okay, so in my book, this starts on page 388, 389. There's no page number on it, but that's where it is. So the bowel has been called the second brain. Not only does it contain more neurons than the spinal cord, it secretes neurotransmitters and hormones similar to those of the brain. The digestive system performs the vital task of transforming food into chemicals that cells can absorb and use for energy. It breaks down food into its simplest components, after which it absorbs the components so that they can be distributed throughout the body. Converting food into fuel requires a dozen organs, a vast array of enzymes, and thousands of chemical reactions. So it sounds like there's many opportunities for things to go wrong in there. So an overview of digestive system. You'll see it in the picture here. The digestive system consists of the digestive tract, also known as the alimentary canal, as well as accessory organs. The digestive tract is basically a tube that extends from the mouth to the anus. It contains several distinct sections as shown below, or here in the slide. The accessory organs are separate organs that aid digestion. So the book has this picture, but it also shows specifically that the digestive tract includes the mouth, the pharynx, esophagus, stomach, large intestine, small intestine, rectum, and anus. The accessory organs include the teeth, the tongue, the salivary glands. The liver is an accessory organ. That was on one of our tests. The pancreas is considered an accessory organ, and the gallbladder. Fast fact, the study of the digestive tract and the diagnosis and treatment of its diseases is called gastroenterology. Now there's a box called the body at work, which states digestion breaks down food, both physically and chemically, and transforms it into a substance that cells can use. Mechanical digestion and chemical digestion are two distinct phases of this process. Mechanical digestion, this is the first phase. It involves physically breaking down food into smaller pieces, beginning with chewing in the mouth and continuing with contractions and churning in the stomach and small intestine. Chemical digestion, the second phase of digestion, uses digestive enzymes produced in the salivary glands, stomach, pancreas, and small intestines to break down food particles into nutrients such as glucose, amino acids, and fatty acids that cells can use. Once nutrients are released from food, they move into the epithelial cells lining the digestive tract before passing into the bloodstream for distribution throughout the body. Food that isn't digested or absorbed becomes waste, feces, and is eliminated from the body. Then there's a fast fact shown that food material inside the digestive tract is considered to be external to the body. I'm not sure why they're saying that. I think it might be more accurate to state that it's maybe not considered a sterile body area, but don't take that for a fact yet. Let's keep on reading here. So, the tissue layers of the digestive tract. 4 layers of tissue make up the walls of the digestive tract. There's the mucosa, the submucosa, the muscularis, and the serosa. The mucosa, so the book is showing like detailed descriptions for the mucosa, the innermost layer, and then those other three layers. It also is showing the enteric nervous system as the picture depicts, and there's a fast fact that says the serosa is actually the visceral layer of the peritoneum. Anyway, as you may recall, the visceral layer of the peritoneum covers the organs in the abdominal pelvic cavity. The parietal layer of the peritoneum attaches to the walls of the cavity. The body at work. The network of nerves, called the enteric nervous system, ENS, innervates the digestive system, consisting of 100 million neurons. The enteric nervous system, a part of the autonomic nervous system, regulates digestive tract motility, secretion, and blood flow. One portion of the ENS, the submucosal plexus, is embedded in the submucosa. Another portion, the myenteric plexus, resides between the two layers of the muscularis. The enteric nervous system usually communicates with the central nervous system, the CNS. However, even if contact between the two systems is severed, the ENS will continue to function. This amazing self-contained nervous system contains sensory neurons that monitor mechanical and chemical conditions within the digestive tract, motor neurons that control the churning and movement of the intestines, and still other neurons that control the secretion of enzymes. It also contains support cells similar to the astroglia of the brain, and finally, it uses more than 30 neurotransmitters, most of which are identical to those found in the CNS. Another fast fact before we move on to the peritoneum. Organs like the stomach and liver are enclosed by mesentery or serosa on both sides, placing them within the peritoneal cavity, intraperitoneal. Organs such as the duodenum and most of the pancreas lie against the dorsal abdominal wall. Mesentery covers only their ventral sides, so they are outside of the peritoneal cavity. They are retroperitoneal. All right, so let's talk about the peritoneum. I am on page 391. Because the stomach and intestines vigorously contract as they digest, they need to be free to move. At the same time, they need to be anchored enough so that the intestines don't twist or kink when the body changes position. Layers of visceral peritoneum are called the mesenteries. Suspend the digestive organs within the abdominal cavity while anchoring them loosely to the abdominal wall. Mesenteries also contain blood vessels, nerves, lymphatic vessels, and lymph nodes that supply the digestive tract. Although this figure shows the intestines separated from each other, in actuality, they are very closely packed. Extending from the greater curvature of the stomach and hanging down over the small intestines like an apron is a portion of the mesentery called the greater omentum. Deposits of fat scattered throughout the omentum give it its lacy appearance. Besides helping to prevent friction, the omentum also helps localize infection. If areas of inflammation develop in the stomach or intestines, the omentum adheres to the area to keep the infection from spreading to the rest of the abdomen. The mesocolon fixes the colon to the posterior abdominal wall. So what is going to be important here, right now as a nurse, we don't think that the greater omentum is so important, but actually, because there's so much going on in this cavity, all of these structures are important, especially when something goes wrong or somebody has had surgery, if you've had any abdominal surgery, you can start forming scar tissue, which may not be as flexible as the natural native tissue that would be there without that. So that can affect the way our digestion functions, and things could get hung up and be problematic. If you have it could cause a herniation, um, and other things where, certain things you don't want them to stick together, but others areas they do need to. So it's very complicated in our abdomen. Fast fact, because the peritoneal cavity contains empty space, it can fill with fluid from disease or trauma. The accumulation of fluid in the peritoneal cavity is called ascites. The lesser omentum extends from the lesser curve of the stomach to the liver. It looks like it's above the stomach. And then the greater omentum, that's the big part, is going to be below it. Okay, so now let's talk about the mouth. Oh no, there's a question here. The layer of the digestive tract that contracts and relaxes to propel food forward is the muscularis. So the mucosa is the innermost layer, and the submucosa is a layer of connective tissue that contains glands, blood vessels, lymphatic vessels, and nerves. And then the serosa is the outermost layer that covers the portion of the digestive tract within the peritoneal cavity. Okay, so now we'll talk about the mouth. The mouth is also called the oral or buccal cavity. It is surrounded by lips and bordered on each side by the cheeks. The palate forms the roof of the mouth, while the tongue and its muscles form the floor. The mouth is the entryway to the digestive tract. It's also where digestion begins. That could be a question on a test. Digestion begins in the mouth. Okay, so the salivary glands. The salivary glands secrete saliva, a clear fluid consisting mostly of water, but also containing mucus, an enzyme that kills bacteria, antibacterial compounds, electrolytes, and 2 digestive enzymes. Besides the major salivary glands shown in the figure, the mouth also contains minor salivary glands in the tongue, inside the lips, and on the inside of the cheeks. So they're showing the parotid gland, which lies just underneath the skin, anterior to the ear. Its duct drains saliva to an area near the second upper molar. The mumps virus causes swelling and inflammation of the parotid gland, right there in front of your ear. The submandibular gland empties into the mouth on either side of the lingual frenulum. And then the sublingual gland, shown here, drains through multiple ducts onto the floor of the mouth. Okay, teeth. Digestion begins when food enters the mouth and is chewed, a process called mastication. Besides breaking food into pieces small enough to be swallowed, chewing allows food to become moistened with saliva. The adult mouth contains 32 permanent teeth designed to cut, tear, and grind food. The body at work. After developing beneath the gums, teeth erupt beginning at about age 6 months. 20 of these early teeth, called deciduous teeth or baby teeth, emerge in a predictable order until about the age of 2.5 years. Then, between the ages of 6 and 13 years, the deciduous teeth fall out and are replaced by 32 permanent teeth. The figure on this page shows the age at which eruption for the upper teeth. The corresponding teeth on the lower jaw erupt at about the same time although some erupt slightly later or even earlier than those on the upper jaw. Fast fact: dentin and cementum can regenerate if damaged, but enamel cannot. Enamel is the hardest substance in the body. Which enzyme acts in the mouth to begin the breakdown of starch? That would be the A, amylase, because the other choices were pepsin, trypsin, and sucrase. And pepsin acts in the stomach to digest protein. Trypsin is a pancreatic enzyme that breaks down protein in the duodenum, and sucrase acts in the intestine to digest sucrose. So now we'll talk about the passage of food, the pharynx. This is on page 394. After food leaves the oral cavity, it moves into the pharynx. For detailed information about the pharynx, see Chapter 17, Respiratory System. While air moves through all three divisions of the pharynx, the nasopharynx, the oropharynx, and the laryngopharynx, food moves through only the last two of those divisions. So air moves through all three of them, but food only goes through the last two. It doesn't go through the nasopharynx, but it goes to the oropharynx and the laryngopharynx. So after the food has been broken down by the teeth and moistened by saliva, the tongue manipulates the bolus to the back of the oral cavity. At this point, the soft palate lifts, closing off the nasopharynx, while the larynx rises, forcing the epiglottis over the entrance to the trachea, and food moves through the oropharynx and the laryngopharynx on its way to the esophagus. Connecting the pharynx to the stomach is the esophagus, a muscular tube about 10 inches long or 25 centimeters. Fast fact: swallowing requires the coordination of 22 muscles in the mouth, pharynx, and esophagus, all controlled by nerve impulses sent from the medulla oblongata and the pons. Yeah, it would surprise me in our clinical rotations to learn that some people have to be reminded to swallow, because it's something that I never think about. But I do need to think about it when I'm feeding other people, because if they don't swallow their food, I shouldn't be attempting to feed them another bite. Another fast fact is heartburn or indigestion is a burning sensation that results from the regurgitation of acidic stomach contents into the esophagus. Glands within the wall of the esophagus secrete mucus that helps lubricate the food bolus as it passes through. When the bolus enters the esophagus, it triggers wave-like muscular contractions, peristalsis, that prepare the food toward the stomach. And that always, like, I noticed the other day that I had a big blob of peanut butter that I swallowed, and man, I needed to drink some water, because the the lubrication that the glands within the wall of the esophagus secrete were insufficient, and I could just feel the peristalsis trying to get that lump of peanut butter down the esophagus and into my stomach. So now the next thing we'll talk about is the stomach. Just below the diaphragm, the digestive tube expands to form the stomach, a muscular sac whose primary function is to store food. The stomach also prepares food for digestion, most of which occurs in the intestines. Specifically, the muscles of the stomach contract and churn to break food into smaller particles and to mix it with gastric juice. What results is a semi-fluid mixture called chyme. Chyme leaves the stomach and enters the duodenum, passing through the pyloric sphincter. The normal curvature of the stomach creates two anatomical landmarks: the lesser curvature, which would be this little short section here, and along the upper surface of the stomach, and the greater curvature along the lower surface. The stomach itself is divided into 4 regions as shown here: the cardia, fundus, body, and pylorus. The body at work. While enzymes in the stomach partially digest protein as well as small amounts of starch and fat, most of the digestion process and the absorption of nutrients takes place in the intestine. Alcohol is also absorbed mostly by the small intestine. However, the rate at which alcohol is absorbed depends on how quickly the stomach empties its contents into the intestine, which is why eating before consuming alcohol slows the effect of the alcohol. The stomach contains the same layers as the rest of the digestive tract: the mucosa, submucosa, muscularis, and serosa. However, the muscularis portion of the stomach has an extra layer of oblique muscle in addition to longitudinal and circular layers. So that means it can really kind of get itself twisted up while it's trying to crush the food and mix it. So the addition of the oblique muscle gives the muscles of the stomach wall a crisscross pattern. This allows the stomach to contract and churn vigorously as it processes food. When the stomach is empty, the mucosa and submucosa are wrinkled into folds called rugae. As the stomach fills with food, the rugae flatten and the stomach expands. To illustrate, an adult's empty stomach has a volume of about 50 ml, which is less than 2 ounces. It typically expands to 1 to 1.5 liters. Okay, the gastric mucosa contains depressions called gastric pits. Several different glands called gastric glands open into the bottom of each gastric pit. These glands secrete the various components of gastric juice. Gastric glands produce up to 3 liters of gastric juice each day. Fast fact, the stomach empties in less than 4 hours following a liquid meal, or it may take as long as 6 hours to empty following a meal high in fat. What is the purpose of rugae? A, to secrete gastric juice. B, to propel food residue through the small intestine. C, to allow the stomach to expand. Or D, to help break food into small particles. And the correct answer is C, to allow the stomach to expand. So this slide is showing the formation and movement of the chyme. On page 396, the body at work says, swallowing signals the stomach to relax so as to allow food to enter. Once the food is entered, the stomach goes to work, mixing the food with gastric juices and propelling it forward toward the duodenum. So here in number 1, contractions originate in the fundus and move toward the pyloric region, starting out gently and growing progressively stronger. Wave-like peristaltic contractions break down the food and mix it with gastric juices to form chyme. And then number 2, chyme moves toward the pyloric sphincter, propelled by the rhythm of the contractions. Under the pressure of a contraction, about 30 milliliters of chyme squirts into the duodenum. Number 3, the stomach continues to churn and mix its contents as it gradually releases chyme into the duodenum. This continues until the stomach empties, which takes about 4 hours following the typical meal. Page 397, body at work, it says the stimulation of gastric secretion occurs in 3 phases. Each phase, the cephalic phase, the gastric phase, and the intestinal phase, is activated by a different part of the body: the brain, the stomach, and the intestine, respectively. So number 1, the mere thought of food, as well as its sight, smell, or taste, creates neural impulses that are relayed to the brainstem, the parasympathetic nervous system that then signals the stomach to secrete gastric juice as well as gastrin. Gastrin further stimulates gastric secretion. Because the brain controls this phase of gastric secretion, it's called the cephalic phase. The next phase, the gastric phase, begins when food enters the stomach. The stretching of the stomach as it fills with food triggers nervous reflexes that increase the secretion of gastric juice and gastrin. Number 3, as chyme moves into the duodenum, the intestinal phase begins. At this point, the duodenum triggers nerve impulses and secretes hormones, both of which inhibit gastric secretion. Now, there's a purple box that says Life Lesson, Peptic Ulcer. Crater-like sores or ulcerations in the lining of the stomach or duodenum are called peptic ulcers. Typical symptoms include a gnawing or burning pain in the middle or upper stomach between meals or at night, bloating and heartburn. Untreated, ulcers can erode through the organ wall, resulting in a potentially fatal hemorrhage. While there is no single cause of ulcers, an acid-resistant bacterium called Helicobacter pylori or H. pylori is often implicated. By invading the mucosa of the stomach and the duodenum, the bacterium causes chronic inflammation that often leads to the development of an ulcer. Another common cause of peptic ulcers is the use of non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. These drugs interfere with the production of mucus that protects the lining of the stomach and the duodenum, thus opening the door to chemical damage. Ulcers caused by H. pylori are usually successfully treated with antibiotics. The body at work. Vomiting may result from a variety of stimuli: overstretching of the stomach, chemical irritants such as alcohol or toxins, or even pain or fear. When these types of stimuli occur, the emetic center of the medulla oblongata sends 2 types of impulses, one to the upper esophageal sphincter to open, and one to the esophagus and the body of the stomach to relax. As this is happening, the abdominal muscles forcefully contract to force chyme out of the stomach and mouth, which is rather unpleasant, I must say. Okay, liver. Although the liver, gallbladder, and pancreas are accessory organs of the digestive system, they play a crucial role in the digestive process. Each of these organs secretes digestive fluids or enzymes into the digestive tract at the junction of the stomach and small intestine. The liver, the body's largest gland, the liver, fills the upper right abdomen below the diaphragm. Even more impressive than its size is its function. The liver performs over 250 tasks, including storing and releasing glucose, processing vitamins and minerals, filtering toxins, and recycling old blood cells. So, when you destroy your liver with alcohol, you're impairing your body's ability to do over 250 tasks. So it's probably better just to refrain from that. Keep the body in good shape. This chapter focuses on the liver's role in digestion. More of the liver functions will be discussed in chapter 21, nutrition and metabolism. The liver has 4 lobes. 2 of the lobes, the right and left lobes, are visible from an anterior view. Fast fact, the term hepatic refers to the liver. Okay, the right and left lobes are separated by the falciform ligament, which also serves to anchor the liver to the abdominal wall. Fast fact, swelling and inflammation of the liver is called hepatitis. Hepatitis is a symptom rather than a condition, although the term is often used to refer to a viral infection of the liver. Two additional lobes called the caudate lobe, which is near the inferior vena cava, and the quadrate lobe next to the gallbladder are visible from behind. See them in this picture here. Liver lobules, tiny six-sided cylinders called hepatic lobules, fill the interior of the liver. These are the functional units of the liver. So there's a central vein which passes through the core of each lobule. Sheets of hepatic cells called hepatocytes fan out from the center of the lobule. In between the sheets of cells are passageways filled with blood called sinusoids, tiny canals in the canaliculi carry bile secreted by hepatocytes. Blood flow through the liver. Each liver lobule receives nutrient-rich venous blood from the intestines as well as oxygenated blood from the celiac trunk. So nutrient-rich blood from the stomach and the intestine enters the lobule through small branches of the portal vein. 2. Oxygen-rich blood enters the lobule through the small branches of the hepatic artery, shown here. So remember, the veins don't have oxygen. So this portal vein brings blood to the liver that does not have oxygen. However, that's insufficient. We also need some that does contain oxygen, so the hepatic artery will deliver the oxygenated blood. Also, phagocytic cells called Kupffer cells remove bacteria, worn out red blood cells, and debris from the bloodstream. The central vein carries processed blood out of the liver, and the canaliculi carry bile secreted by hepatic cells and ultimately drain into the right and left hepatic ducts. Which liver structure filters blood to remove nutrients as well as toxins? And we just went over that. The answer is B, the sinusoids, because the Kupffer cells are phagocytic cells that remove bacteria and debris, and the canaliculi carry bile secreted by hepatocytes. Gallbladder. A sac attached to the underside of the liver, the gallbladder, stores and concentrates bile. The gallbladder is about 3 to 4 inches or 7 to 10 centimeters long and holds 30 to 50 milliliters of bile, so 1 to 2 ounces. Life lesson, gallstones. Hard masses called gallstones can form inside the gallbladder, often because of excessive cholesterol in the bile. Gallstones may cause no signs or symptoms. However, if a gallstone lodges within a duct, excruciating pain may occur. If the gallstone blocks the flow of bile into the duodenum, bile will back up into the liver and be absorbed into the bloodstream, resulting in jaundice, a yellow discoloration of the skin, mucous membranes, and sclera of the eye. Treatment of symptomatic gallstones includes surgery to remove the gallbladder or medications to dissolve the gallstones. The body at work. Each day, the liver secretes up to 1 liter of bile, a yellow-green fluid containing minerals, phospholipids, bile salts, bile pigments, and cholesterol. The main bile pigment is bilirubin, which results from the breakdown of hemoglobin. However, The most important component of bile is bile salts. Formed in the liver from cholesterol, bile salts aid in the digestion and absorption of fat in the small intestine. After secretion, 80% of bile salts are reabsorbed in the final section of the small intestine, the ileum. It is then returned to the liver, where hepatocytes absorb and then secrete the bile once again. So it's recycled in the body, assuming everything's going well. The 20% of bile not reabsorbed is excreted in feces. In fact, bile is responsible for giving feces its brown color. If bile isn't being secreted, or if the flow of the bile is obstructed, feces may become a grayish white in color. That's important to note when you're treating your patients. Pancreas. The pancreas, I'm on page 401, lies behind the stomach. Its head is nestled in the curve of the duodenum, while its tapered tail sits below the spleen and above the left kidney. The pancreas is both an endocrine and exocrine gland. Its endocrine function centers on pancreatic islets that secrete insulin and glucagon. Most of the pancreas, though, consists of exocrine tissue. Each day, the pancreas secretes about 1.5 liters of pancreatic juice, essentially just digestive enzymes and an alkaline fluid, into the small intestine. The body at work. The vagus nerve and the hormones cholecystokin, gastrin, and secretin stimulate the secretion of bile and pancreatic juice. Cholecystokinin, CCK. The arrival of chyme in the duodenum stimulates the duodenum to secrete the hormone CCK, the one I can't pronounce very well. Cholecystokinin, CKK, causes gallbladder contraction, forcing bile into the bile duct and the release of pancreatic enzymes. At the same time, it prompts the hepatopancreatic sphincter to relax, which allows bile and pancreatic juice to enter the duodenum. Gastrin. This hormone from the stomach and duodenum triggers both gallbladder contraction and pancreatic enzyme secretion. However, it exerts a much less powerful effect than does CKK. Secretin. The acid in chyme also triggers the duodenum to release secretin. Secretin causes the bile and pancreatic ducts to release bicarbonate, which helps to neutralize the stomach acid entering the duodenum. Okay. Most chemical digestion and most nutrient absorption occurs in the small intestine, filling most of the abdominal cavity below the stomach and held in place by mesentery. The small intestine consists of 3 divisions: the duodenum, the jejunum, and the ileum. The duodenum is the first 10 inches or 25 centimeters of the small intestine. The name duodenum is Latin for 12. The duodenum is about 12 finger breadths long. It begins at the pyloric valve and ends as the intestine turns abruptly downward. The duodenum receives chyme from the stomach as well as pancreatic juice and bile, and this is where stomach acid is neutralized and pancreatic enzymes begin the task of chemical digestion. More digestive processes occur here than in any other part of the intestine. So the duodenum is so important. Just the small section does so much for us. The jejunum consists of the next 8 feet or 2.4 meters of small intestine. Many large, closely spaced folds and millions of microscopic projections give the jejunum an enormous surface area. making it an ideal location for nutrient absorption. The wall of the jejunum is thick and muscular with rich blood supply and imparts a red color to this part of the intestine. The ileum is the last 12 feet of the intestine. The wall of the ileum is thinner and it has less blood supply than does the wall of the jejunum. Clusters of lymphatic nodules called Peyer's patches are scattered throughout the ileum. Okay, the body at work. Contractions in the small intestine help break down food particles, mix food with digestive juices, and bring digested food in contact with the intestinal mucosa to facilitate absorption. Contractions also propel food residue toward the large intestine. The two types of intestinal contractions are called segmentation and peristalsis. So segmentation involves ring-like constrictions that occur at intervals along the small intestine. When the first contracted areas relax, new contractions occur in other locations. This back and forth movement breaks up food particles and kneads the contents of the intestines, thoroughly mixing it with digestive juices. And peristalsis begins when most of the nutrients have been absorbed and undigested residue remains. With this type of contraction, successive wave-like ripples move the digested material along the GI tract. That's what's shown here. The intestinal lining contains multiple projections that increase the surface area and enhance the absorption of nutrients. Fast fact, the folds, villi, and microvilli increase the surface area of the small intestine by more than 500 times. The body at work. Most nutrients pass into the bloodstream through capillaries and then travel to the liver. Most fat, however, is absorbed by the lacteal. Okay, what is the purpose of the gallbladder? Is it A, to secrete pancreatic enzymes, B, to produce digestive enzymes, C, to produce bile? I don't think it's any of those. Or D, to store bile. And the answer is D, to store bile. The gallbladder has no role in producing or secreting digestive enzymes. And bile is secreted by hepatic cells. So it's just for storage. So you can see why some people have to have their gallbladder removed, and it's not really removing any enzyme production. It's just removing where we store the bile. Okay, so let's talk about the intestinal lining now. On page 403, the intestinal lining contains circular folds that slow the progress of chyme and increase its contact with the mucosa. On top of the circular folds are projections called villi. Singular is villus. The villi are covered by absorptive epithelial cells as well as mucus-secreting goblet cells. An arteriole, a venule, and a lymph vessel called a lacteal fill the core of each villus. Pores at the bases of the villi, called intestinal crypts, contain goblet cells that secrete mucus that helps the passage of food. They also serve as sites for rapid cellular growth, producing new cells to replace those shed from the villi. There's a lot going on in there. Epithelial cells covering the villi have a brush border of ultrafine microvilli. Besides further increasing the absorptive area, the microvilli produce digestive enzymes. Chemical digestion and absorption. Once food has been mechanically broken down into minute particles, chemical digestion takes control. Using digestive enzymes, chemical digestion transforms food molecules into particles that can be absorbed into the bloodstream. By the time food residue leaves the small intestine, most nutrients have been absorbed. The process of digestion and absorption varies between classes of nutrients, with major classes being carbohydrates, proteins, and fats. Okay, so carbohydrates consist of sugars called saccharides. There's the polysaccharides, disaccharides, and monosaccharides. So polysaccharides contain many saccharide groups linked together. These include starches and glycogen. Disaccharides contain two groups. So remember, di means two. Disaccharides contain two groups linked together. These include sucrose, lactose, and maltose. And finally, the monosaccharides contain only one saccharide group. These include glucose, fructose, and galactose. Most foods contain polysaccharides, which must be broken down into smaller particles, namely disaccharides and monosaccharides. To do this, the digestive system uses enzymes. Fast fat cellulose is an indigestible carbohydrate found in the diet. Even though cellulose doesn't provide the body with nutrients, it is an important source of dietary fiber, and cellulose will be discussed further in Chapter 21, Nutrition and Metabolism. So the process begins in the mouth, where salivary glands secrete the enzyme amylase. Salivary amylase works to hydrolyze polysaccharides into disaccharides. Once the food is swallowed, the low pH of the stomach acid inactivates the salivary amylase. By this point, though, about 50% of the starch has already been digested. When the resultant chyme reaches the small intestine, it mixes with pancreatic amylase, and the process of starch digestion resumes. The final steps in carbohydrate digestion take place at the level of the villi. The membranes of the epithelial cells covering the villi contain the enzymes sucrase, lactase, and maltase. The chyme slides against the brush border of the epithelial cells. The enzymes bind with disaccharides. This is called contact digestion. The final step in the digestion process produces glucose, which is immediately absorbed. Proteins. Proteins are complex molecules made up of folded and twisted chains of amino acids linked together by peptide bonds. Before the body can absorb amino acids, it must break the peptide bonds. To do so, it uses enzymes called proteases. Absent from saliva, proteases work in the stomach and the small intestine. So in the stomach, the enzyme pepsin hydrolyzes the peptide bonds between certain amino acids. As soon as chyme enters the duodenum, pepsin is inactivated. At that point, the pancreatic enzymes trypsin and chymotrypsin assume the task of breaking the peptide bonds. Finally, the brush border enzymes called pepsidases break the remaining chains into individual amino acids, which are then absorbed into the bloodstream. Fast fact, amino acids arrange themselves in a wide variety of combinations, with each combination employing a slightly different peptide bond. As a result, the body calls upon a vast array of proteases to digest proteins. Fats. Although fat digestion begins in the mouth, most fat digestion occurs in the small intestine. Because fat doesn't dissolve in water, it enters the duodenum as a congealed mass. To facilitate digestion, the fat must be broken into smaller droplets, a process called emulsification. So, when a fat globule enters the duodenum, two substances in bile, lecithin and bile salts, break up the fat into small droplets. Once the fat is emulsified, pancreatic lipase, the main fat digesting enzyme, begins to digest the fat. In the process, fats are broken down into a mixture of glycerol, short-chain fatty acids, long-chain fatty acids, and monoglycerides. Glycerol and short-term fatty acids are absorbed into the bloodstream of the villi. Long-chain fatty acids and monoglycerides, which are too large to be absorbed by capillaries, are absorbed into the walls of the villi. There they are changed into triglycerides, which eventually enter the lacteal of the villi. After traveling through the lymphatic system, the triglycerides enter the bloodstream at the left subclavian vein. All right, page 406, large intestine. Once the food has been processed and its nutrients are absorbed, the remaining residue is ready to leave the small intestine for the large intestine. In fact, about 500 milliliters of residue, which would be, half a liter, consisting of undigested food, sloughed up epithelial cells, minerals, salts, and bacteria enter the large intestine each day. The large intestine absorbs large amounts of water from the residue before passing the resulting waste material, feces, out of the body. The following figure shows the regions of the colon beginning with the cecum, where the food residue enters the colon, and ending with the anal canal, through which the waste material leaves the body. All along the way are pouches called haustra, which result from increased tone of the smooth muscle and the muscularis layer. Fast fact: appendicitis, an inflammation of the appendix, results when a blockage traps infectious material inside the appendix. Surgical removal of the appendix, appendectomy, is the most commonly performed emergency surgeries. Now, some data is suggesting today that we're actually taking more out than we really need to, and that some of these could be addressed using an antibacterial therapy. But that is not for today's chapter. So we are almost on the last page. So the most nutrients are absorbed in the stomach? I don't think so. Small intestine is what I think it is, and I don't think it's the large intestine or the mouth. And it is actually the small intestine. That's where the absorption takes place. Okay, so now I'm going to read the last page, which has a box, two boxes about the body at work. One of them says that the large intestine houses over 700 species of bacteria. These are called bacterial flora. These bacterial flora, also called normal flora, perform a variety of functions beneficial to the body's health. For example, some of the bacteria digest cellulose and other materials for which we have no digestive enzymes. Other bacteria produce significant amounts of vitamins, particularly vitamin K and a B vitamin. One of the products of bacterial action is intestinal gas, or flatus. Although flatus partially results from swallowed air, it also results from bacterial fermentation of undigested polysaccharides. Flatus, or farts, right, consists mainly of nitrogen and carbon dioxide, although it also contains hydrogen, methane, and hydrogen sulfide. When a large amount of undigested nutrients pass into the colon, painful cramping can result as the bacterial action produces an increased volume of intestinal gas. So gas, those are air bubbles. And you know what happens when air bubbles are in fluid? They like to float to the top. So you can have a lot of pain with gas bubbles that are trapped at your hepatic flexure or your splenic flexure, because you're really having to work against gravity to try to get those bubbles or the gas way down here to the bottom and out your bottom. So there are treatments for that help to break up those big bubbles into smaller bubbles that can help our patients that are experiencing pain from gas. The other box for the body at work talks about the intestinal contractions that move feces through the colon toward the rectum. Haustral contractions. As haustrum fills with residue, it becomes distended, which stimulates the haustrum to contract. Besides mixing the residue, the contraction pushes the residue into the next haustrum. Haustral contractions generally occur every 30 minutes. Stronger peristaltic contractions, called mass movements, move larger amounts of material several inches at a time along the colon. In particular, these movements are triggered by the filling of the stomach or duodenum. The mass movement of feces into the rectum stimulates the defecation reflex. The rectum contracts and the internal anal sphincter relaxes. When the external anal sphincter relaxes, which is under voluntary control to prevent the uncontrolled release of feces, feces is expelled from the body, defecation. There's a fast fact. Hemorrhoids are swollen, engorged veins in the anal canal. So, one last thing, there's a purple box at the bottom of page 407 that says Life Lesson. Changes with aging. Efficiency of the digestive system decreases with age. Doesn't everything, okay? Over time, the muscular wall of the digestive tract weakens and intestinal peristalsis slows, often resulting in constipation and hemorrhoids. Peristalsis also slows in the esophagus, making swallowing more difficult. The cardiac sphincter, the sphincter that regulates the flow of food from the esophagus into the stomach, also weakens, often leading to esophageal reflux and heartburn. Tooth loss is common, making eating difficult. Factoring in diminished sensations of smell and taste, it's easy to understand why many elderly individuals have poor appetites. Aging also interferes with the absorption of nutrients. Specifically, the stomach has decreased production of hydrochloric acid and other digestive enzymes, leading to poor absorption of vitamin B12. Efficiency of the liver also declines, slowing an elderly individual's ability to metabolize drugs, placing them at greater risk for drug overdose. And that's all for this chapter. I'm going to encourage everyone to test your knowledge. My book has the answers with an explanation right there on the same page as the question. So good luck with that, and thank you for being with us today.